name. You guys want to hear how I, as a pathologist, would describe fruit lesion? Yeah. Right. And say about 50% of the orange is discolored, it has apple texture. The affected region is about 90% green, it has a white rim. The texture of it is kind of fuzzy to flaky. It's cerebriform in places, being like a brain, like a cerebrum. You see right how brainy that looks right there? It has a roughened texture. I can't tell exactly what it would feel like on cross section, but I imagine it's a little bit soft. I don't believe it has a bone. How's that? This one, I would say, that compared to a normal apple, this is smaller than normal. It's got one side of it is kind of severely shrunken or depressed. The other half has a normal texture. This depressed area is discolored, kind of black to yellow brown to mahogany. And if I look really close right here, there are some little yellow flecks. You guys see those? Yeah. Tiny little yellow flecks on the surface. It almost has, I think someone said, a granular texture yesterday. The skin or the capillary surface of the apple around this lesion is wrinkled and discolored brown to tan. There are also multifocal, what look like punctures through the skin that go into the flesh of the apple underneath. This one probably does have an odor, but I can't tell you what it is. Scratch instead. That makes sense? Yeah. Do you guys see the difference between that description and the descriptions we did yesterday? This is like high level spot the difference. So you have a normal apple on one side. I want to know everything that is different about this apple from a normal apple. Every difference, no matter how small. Because if we don't know diseases of apples, we don't know what of those changes are meaningful. So we're going to describe them all, and we're going to be as thorough as possible. You're going to zoom way in and look at these tiny little dots on here. Yeah.
Wait, is there like an equivalence or an overlap Venn diagram between descriptors that we use in pathology and descriptors that we use in clinical pathology when we're talking about, I don't know, you play something and you talk about, it's potentate, it's
bacteriology?
Sure.
Yeah. Sure. I mean, words have discrete meanings, right? So when we say papillary, anything can be a papillary. It's a shape, right? Cerebriform, anything can be that texture. These are just descriptive, objective words, right? It's like saying, can we use the word pink to describe more than one thing?
Yes, we can.
Right? Yeah, they're objective descriptors. Use them wherever they're appropriate. Other questions? Yeah.
Would you want to say anything about, like, could you say something about how the apple, it looks like the lesion or whatever the problem is with it is like spreading to the non-affected side? Like it looks like there's a bruising on the
So that's right. You picked up on some areas I didn't mention, which is these little things, right? Those are also probably lesions. So this brings us to a question of distribution. So you have three basic choices when you're describing a lesion distribution. There's a lot of other little ones, but there's three main ones. Is it focal, multifocal, or diffuse? Focal is easy. It means there's one spot. This is a large focal lesion. Maybe there's some multifocal, right? There's these little spots. These are multifocal lesions, these little bruises or punctures. The rot is a focal lesion. If it's multifocal, there is normal tissue in between and you have multiple nodules or areas of lesion. If it's diffuse, there is no normal. Everything is affected. The tissue is 100% gone. That makes sense? Are you ready to practice with some real tissues that are not fruits?
Oh, sorry. Oh, I have a question. So,
Yeah.
fixation.
Yeah.
I know that there's like Normal and abnormal, is there like a range or a discussion?
There's well demarcated and poorly demarcated.
Okay.
If you wanna be on the fence, you can always add the word moderate to anything you say, and then it's right in the middle. It's moderately well demarcated. What does that mean? Nothing. It's half and half, and I could think it is nothing.
I have.
Yeah.
Can you describe the apple, can you say in the description apple?
Yeah.
Is apple-
When you start this description, you're gonna start it with liver. This is a liver, or it was at some point, it's past. Does that make sense? Yeah, always tell me where I am. Tell me, one other important thing about this, just using the apple as a metaphor. There's a difference between what's going on in the surface and what's going on deep in the tissue, right? The surface here I described as wrinkly, but there's more lesion underneath here, that flesh or the parenchyma of the apple, right, is also undergoing changes. So we wanna distinguish what is the tissue, first of all, where in the tissue are we? Are we on the serosal surface, if we have a serosa? Are we in the lumen or the mucosa, or a tissue with the lumen? Where are we? Give me the anatomic part.
If you can cut into the tissue you're describing, can you describe the parenchyma? Or
If you don't cut into the tissue you're describing, you've done a bad job, go back to cutting the tissue.
So you're gonna have both.
I always want information on cross section, yeah, for sure. Here where I'm showing you pictures, a lot of this course is pictures, because I can't bring gross things into class and try to. We're kind of inferring the texture, which again is an experience thing, you're gonna need to see a lot of things, feel a lot of things. Eventually, you're gonna be able to look at that and be like, oh yeah, I know exactly what that feels like, because I've seen it and I have felt that before. Nobody believes me. No, who gets it? We got this. 3.5 years. Really good questions, or? So important, this is foundational. Yeah,
So I'm like hesitating to want to practice this without like definitions of what all of these different shapes and descriptors are.
okay,
So like I put a thing in the like discussion board last night about like. I would love to create a document that has like, here's a picture, an example of a full voice versus full voice. Or
that.
just like
that.
just like, right, but there, you post a really great document that has like all of the words. But like, I don't know that I have a mapping that goes from the word to the picture, and is this something like, do we have an atlas that has descriptions of
I don't
these?
think so, because you kind of pick more up as you go along, but you could start with basic things, you know, colors, texture and shapes. If it has oid on the end, that just means like, so oval and ovoid are kind of the same thing.
One's 2D.
One is an oval and one is like an oval. Again, what does that mean? It's an oval, right?
Well, I think doesn't one mean it's 3-dimensional and one's like
No.
really 2-dimensional?
No, they're just shapes. You're overthinking it. You're overthinking it. Either organs, they're always 3-dimensional. Unless we're in pathology and it's 2-dimensional. Don't worry about it. All right, let's describe this liver. Yeah, right. We can do it. Does anybody want to volunteer to describe it, or should we group think it and just shout out descriptors that we feel are appropriate? Group think. Okay, spot the difference. Here's a normal liver, this little guy. Here's a very abnormal liver. Hit me. It's diffuse. There is no normal liver in this picture. That is correct.
The bulging on both.
Multinodular, I love bulging, all of that, great. It's on the serosal surface. Do you think it goes into the parenchyma, or do you think it's only on the capsular surface?
I don't know.
Don't know yet.
But I would guess the parenchyma is irregular.
What do we think? Let's vote. Parenchyma normal. Parenchyma not normal. Yep, we group think that one. Crowdsource, that's the one, not group think. Group think's bad, crowdsourcing is good. Okay, multinodular, we're pretty sure it affects the parenchyma. We said it was diffuse, so if it's diffuse, it's gotta be affecting the parenchyma. Right, unless it's diffuse capsular. Good, more?
Light red.
Light red, is it diffusely light red?
No.
Uniform.
This looks like Travis.
Multifocal discolored areas, it looks like ground beef, you mean the color, the texture, oh,
The color and the texture,
that's a really great descriptor. Like raw ground beef or cooked ground beef,
like the. Slightly cooked.
lightly cooked, undercooked, yeah. E. coli risk level, ground beef, is what it looks like. I agree, that's a great word. Tell me more.
Cysts are yellow and red.
Ooh, so a cyst does have a specific definition. It's a space that is lined with epithelium and filled with some kind of secretory product that the epithelium is making. So you're telling me that if I poked a needle in here, I could suck out a bunch of juice?
I don't know that.
What do we think? Can it suck out juice?
Probably.
Cannot suck out juice? Oh, we're really not sure.
I totally post on podcast.
You can poke it and find out. There is no juice. No juice. No. The descriptor for things that look like cysts is fluctuant. You guys know that word?
I do now.
Like a water balloon, it's fluctuant. You poke it and it's got kind of a. Yeah, you know, fluctuant. So you're gonna learn these words, you're gonna hear me say them, and be like, oh, that's a good one. Right? You're gonna collect words, that's what pathology is.
You use that word like, so the other,
These are not fluctuant, they're not cystic, they're not fluctuant.
but if you did have something that was like this in a world cyst, would you say fluctuates or fluctuant?
Fluctuant is an adjective.
Okay.
All of the descriptors are gonna be adjectives,
Okay, so.
right?
Well, up to where the fluctuates.
They're not,
If they were, I'm just saying if they were.
if they were, yes,
Okay.
they would be fluctuant, yes.
I have a good question. I feel like everyone yesterday you said like, let's use colors and like panels and counting color. If we have like a context to like, know what a normal river looks like, and it looks tailored. Can I say feeling it's more like?
Okay, it's not my favorite, but it kind of works. I'd rather you give me a specific color. Like, what color would we describe as normal liver? Red?
Red.
Cherry red. Cherry red triggers pathology alarm bells in my brain. Anybody know the disease that goes with cherry red? Cherry. Cyanide, cyanide poisoning, carbon monoxide poisoning, it's cherry red blood. What's the question? Color, so I actually see a lot of colors here. Yeah,
I was just gonna say, could we maybe describe like the nodules themselves a little more, like their sizes, some.
they're varying sizes, they range in size from blank to blank. That'd be great, that'd be better than ground hamburger, because only this part and this part look hamburgery, this looks kind of like a chicken ovary or something else. Wrong,
The nodules have kind of a marbled color appearance.
yeah.
Yellow and red.
Yeah, I like to hyphenate colors in pathology, so like yellow tan, tan red. I would call this, I don't know, kind of pale pink to yellow. I think some of these are like yellow orange. Actually, that I would use probably the word orange to describe some of these. It's really great. What else?
You say that all water looks relatively normal and unaffected.
Yes, you could say that. That was a great descriptor. Describing normal is never wrong. More?
So with like the cystic kind of thing, we're talking about, fluid. Would pustule also sort of fall under like your effective form of fluid? Because my initial thought was pustule before that, nodule.
So you guys are, again, be careful with description versus interpretation. A pustule is an interpretation. Nouns are interpretations. Adjectives are descriptors. Let's think it for a second. Makes sense? So necrosis is an interpretation. Hemorrhage is an interpretation.
What color did we decide on for the normal liver?
I like mahogany. I don't think it's red, like red, like solo cup red. So I think red. Because we use red in our descriptor to say these red areas were discolored, right? I have not heard any texture words. Can we feel this with our eyes? Soft as your lip, firm as your nose, hard as your forehead. That's important. Do this over and over for the next 3 years. If you tell me something is hard, that tells me there's bone or mineral in there. So be careful with the word hard. Most things are firm. What do we think about this?
No.
Firm. It's probably firm. Yeah. Friable is the pathology word for soft. When something is so soft, it's kind of falling apart in your hands, it's friable. Adjective. Yeah.
Can you describe the tissue at the top?
No, what is that?
The tissue appears to be the same color as prosciutto and possibly the same.
It's the same tissue type as prosciutto. What is it? It's the diaphragm. It's attached to the top. That's anatomy. All right, so we have a couple more livers to practice on. I'm gonna go ahead and describe this for you like I would describe it. So that's okay, and we can jump to the next one. So I would say this liver is diffusely small and shrunken. I think it is not as big as it should be. However, it is also has a diffusely abnormal texture. It's multinodular. The nodules range in size from about 2.5 to 3 centimeters down to a millimeter, 2 millimeters. They are soft to firm. Some of them are a little bit friable, especially these yellow ones. The nodules are anywhere from pale pink tan to multifocal red to occasionally yellow orange in color. Let's see what else. The intervening areas between these nodules are very firm. They are more firm than the nodules. I think that's a good description. These lesions extend into the gut surface because it's diffuse. Anybody know what this is? What? A liver. A liver. What's the disease? What's wrong with it? What's the issue with the tissue? Cirrhosis? Did I hear cirrhosis? Who was that? Who was that? Raise your hand. Loud and proud. Stand up. Right in the box.
Oh, that was right.
This is cirrhosis. Cirrhosis has 2 components. Nodular regenerative hyperplasia. We're going to talk about hyperplasia next week. And fibrosis. We're going to talk about fibrosis and chronic inflammation. Those 2 things together equal cirrhosis, which is this.
Is any of the areas of vascular congestion that we're seeing, are those from that?
Congestion, advanced language. So what are you calling congested here?
There are patchy areas that look like left stroke.
Do you know those aren't hemorrhage?
Are they from that?
I don't know how to answer that. We're not there yet. This whole liver is disease. You've said it's congestion, which is a noun, so that's an interpretation,
Oh, okay.
right? So I don't think there is congestion.
Okay.
Red could be congestion, which is blood inside of vessels. It could be hemorrhage, which is blood outside of vessels. If it's congestion, it could be normal postmortem. If it's hemorrhage, it's probably associated with disease. But I haven't taught you how to interpret that yet, right? So right now, just describe. Don't worry about if you get the disease. You're brilliant, like your colleague over here, know what cirrhosis looks like already in your first year. That's great, but that's not what we're gonna do. That's just half bonus points. Which is like whose line is it anyway points, you're not actually doing anything. Okay, here's a pig, normal liver. Pig liver. Start with distribution. Is it focal, multifocal, diffuse? Diffuse. So there's no normal liver remaining. What you're telling me. The whole liver is affected and all of its abdomen.
Multifocal.
I don't know, I cut it open. These areas look pretty normal to me, these dark areas. So I think this white stuff is the abnormal, and I think in between here is normal liver. It's a pig liver, so there's a little bit of extra connective tissue in it. Guys do pigs in anatomy?
No.
No. You get lots of pigs on your seeing. All right, so I would call this multifocal, because I can see normal liver. What else? What's the contour of this lesion? Your choices are, is it raised, sunken, or flat? If I closed my eyes and felt this, could I feel that there was a lesion here? No, so it's probably flat. I see hand.
I was gonna ask, would you consider this poorly demarcated?
Yeah, I think this is multifocal, pretty poorly demarcated. Tell me more. It's white,
Yeah, I said like general polka dot white pattern.
polka dot white, I like that. Definitely, polka dots are multifocal, right? Yeah. What else you got? Do we think this goes in to the tissue or is it just on the surface? Into the tissue. On the surface. Didn't vote. Doesn't care. Yeah. Hard to tell from this, I will tell you it does go in cross section.
I don't know what a normal big liver looks like, usually I look at them, but is this the normal size of a big liver? It looks.
Do you know how to evaluate livers for size?
No.
So have you had any radiology yet?
No.
Oh, man. We heard. So one way to do it is in the animal, if it extends beyond the costal arch, last rib on radiographs, or when I open up a body, I'm like, well, there's the rib and here's the liver, that's too big. If you have just a liver, look at the edges. Are they sharp or round? If they're sharp, it's probably normal size. If they're round, it's probably big or small. What do you think? Normal. These are sharp, all sharp margins. They come to a taper. More please.
Looks like salami.
It does, or pepperoni, yeah.
It kind of has a gradient of color, more towards the center, it's more of a reddish pink. But as you move towards the edges, it's more of a darker, more vibrant pink.
Oh, vibrant pink, I love that. What do we think this liver feels like? Firm? What's a normal liver feel like? Firm, compared to a normal liver, is it more firm, less firm, same firm? Maybe same firm, maybe a little more firm. Big livers are pretty firm. Any more? I would say this is, the liver is covered with numerous coalescing firm, white, flat lesions. They have kind of a spider web appearance. I would probably stop there. It's not really a lot to describe here. It doesn't really have a texture. It's not really raised. There aren't really any nodules. The shape and size of the liver are normal. I can see the gallbladder poking out right here. It looks pretty normal. Anybody know what this is?
Is this milk spot?
This is milk spot. Milk spot liver. Do you know what the cause of milk spot liver is?
Is it a worm?
It's a worm. Do you wanna eat this pig? You wanna eat this pig? Is this zoonotic?
Yeah.
Ascaris milk spot liver.
Parasite.
So it migrates to the liver and it leaves tracks of, this is scar tissue. So this is all fibrosis. There are not worms here anymore. They have come and gone. And these are their footprints. Just kidding, worms. All right, I'm gonna do this one real quick so we can move ahead. This is a focal lesion, liver from a dog. There are actually multiple lesions here, so when I go back to the normal dog liver, it's very homogeneous, right? I can't really see a texture or a pattern on the surface of this normal liver in a dog. I can in the pig. It's normal for the pig to have a texture. Other things, no, they should be smooth, homogeneous. This has a pattern, right? You guys see that? We call this an enhanced reticular pattern. What it means is, you guys remember back to microanatomy, the hepatic globules, the little hexagons?
Yeah.
We can see them grossly with our eyes. That's what you're seeing. The pattern, it's highlighting all the little hexagons. It means there's something abnormal with the liver, but it's very non-specific. Just says, hey, something's up, I'm not okay. Like flu-like symptoms in the liver is an answer to the other pattern. Could be anything else. So I think this whole liver is actually abnormal. I also think if I'm feeling this with my eyes, it has an abnormal texture. I think it is too soft. Look right here, it's cracking. From our handling it, it's starting to fall apart. So this is an example where I would say something is friable or soft. Normal liver should be firm. This is too soft, it's falling apart. There is the actual lesion is a large focal lesion taking up about 90% of one lobe. It's not super well demarcated. I can't really outline the border over here. I can over here, but here it gets kind of squidgy. I can't really tell what's lesion and what's liver. The surface of this mass has a multinodular texture. The nodules are smooth, firm, and tan on cut section. Some of the nodules have central umbilicus, like a belly button. Does that look like a belly button to anybody else? When a nodule is sunken in the middle, we call it umbilicated because it looks like a belly button. Yeah. We know what this is. A big tumor. What kind of tumor? Did it come from the liver or did it come from somewhere else to the liver? We don't know because it's only one. That's the right answer. This is a primary liver tumor. It is not metastatic. It is one big lesion. Usually metastasis come through the blood and they like a shotgun. Yeah.
There seems to be like a little bit of discoloration or different coloration near the.
Go back to these pictures after we talk about post-mortem artifacts,
Okay.
which are not lesions. You're talking about this around the gallbladder?
Yes.
Yeah.
Right.
Not a lesion. Stay tuned.
Is there any particular scientific indication that's the primary lesion, or is it mostly that it's just one large mass?
I think these are two separate lesions in one image. I think this patient has some kind of underlying liver disease and a liver tumor. I do not think they are necessarily related. Everybody do notice this discoloration. It's kind of brown green and it's right around the gallbladder. Tuck that away for a day or two. Man, why did they put so many livers in here? This is a diffuse change. There is nothing normal here. We've cut into it for you. This doesn't even look like a liver anymore. The liver is diffusely enlarged, very firm, and pale pink. This is probably amyloid, or maybe some kind of glycogen storage disease. I don't remember. There are also these little multifocal red patches. Oh my god. Okay, homework, do on your own. We gotta move on.